Well, good afternoon, everybody. It is meeting time, so I'm going to call the Wayne County Commission Health and Human Services Committee to order. Madam Clerk, what do we got?
Commissioner Marecki. Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Vice Chair Colleen.
Right here.
Chair Baker McCormick has requested an excuse. You have a quorum present.
And she is. Yep. Thank you. All right. Next, Madam Clerk.
B, Chair's remarks.
I'll just mention I was hoping that Director Jordan would be here today. I wanted to thank the department after the last meeting for sending along all the youth assistance program information. I was good to get little bedtime reading, so appreciate it came from the department. Madam Clerk.
C, approval of the November 10th, 2022 meeting minutes.
Been moved and supported. Who did the moving? Anderson moved, Commissioner Marecki supported. Any comments, questions, corrections to the minutes? Hearing none, all in favor of the motion, please say aye. Aye. Opposed? I guess I'll also mention that we got about 5:30 yesterday, we got an addenda, just in case all committee members don't have that. All right, Madam Clerk, what's next?
D, unfinished business. There is none listed.
Excellent. Next.
Item 1, and a new business, forwarding the report for the Youth Assistance Program's yearly outcome and program description for fiscal year 2021 through 2022.
Well, I jumped ahead of myself on this, but this is the report I was referring to earlier. So this is here for, does anybody have questions on the report? And it's here for receive and file. Questions, pleasure of the committee?
Or
Great. It's been moved. I think that was Commissioner Marecki, supported by Commissioner Dobb. All in favor of receiving and filing this item, please say aye. Aye. Opposed? Any abstentions? All righty, Madam Clerk, what's the next item, please?
Item 2, requesting commission approval of Amendment 3 to a 3-year contract with 2 one-year options to renew with house arrest services.
All righty. Do we have someone to present this item, please? Oh, yeah. Operations people, the money people, I see them all start to stir. Name and title for the record, ma'am. What do we have here? You haven't found the button yet? Right at the base. Little gray button. Yeah. Oh, yep.
good afternoon, Cecily
Afternoon.
Hoagland, Administrator for the Juvenile Youth Service Division of HHVS. And this is the house arrest contract for tethers. We are extending, we're taking advantage of the 1-year option to extend the contract, and we're also adding additional dollars. Our volume of tethers have gone up over the last year.
Okay, so we're taking an option here, right?
Yes.
Guess I'd like to ask commission staff, does it matter if if we're taking an option, but we're also increasing the amount? Was that?
Chris Albrecht here on Zoom, policy analyst, commission
Sir.
staff. Chair Colleen, they are, as has been stated, exercising the second option to renew. The department did advise, I'm sure they could advise further, that their expected count of individuals or juveniles rather on tether is increasing. And I'm sorry about my son.
Congratulations, Dad. Keep going.
Thank you. So the department did advise, and I'm sure they could jump in when I'm done, that they do expect an increase in the number of juveniles. Therefore, they are also expecting an increase in the number of juveniles on tether, or I should say they are expecting an increase in the number of juveniles on tether. hence the increase in funds.
Oh, and I see our fiscal policy person, Ms. Carr, would you like to weigh in? Can we do both at once? Take an option to renew and increase the amount?
Yes, Commissioner, we can do both based on the reasonings that they're giving us.
Okay, cool. Questions from committee members on this item? Motion then, if there's no questions.
Move to approve.
Moves, Commissioner Anderson supports. All in favor of the motion, please say aye. Aye. Opposed? Any abstentions? All right, thank you. Madam Clerk, what's next?
Item 3, requesting commission approval of the appointments of Dr. Avani Seth and Assad Turf and the reappointments of Commissioners Alicia R. Bell, Monique Baker McCormick, and Tim Colleen to the Health Choice of Michigan Board of Trustees.
Righty. So we have a couple of new members being proposed here. Dr. Sheth and Mr. Turfy. We just had our meeting yesterday for Health Choice. Any questions from, and you said Mr. Turfy is with us on Zoom?
Yes, I am.
I'm sorry?
Yes, I am. I'm here, sir.
I got you. Doctor is where? Oh, okay. Do you want to say something to us, Dr. Sheth? Yeah.
On. Okay.
Yeah, there it is.
All right, there we go. Chair Colleen Avni Sheth, the Health Officer and Medical Director for the Public Health Division under HHVS. And I thank everyone for the appointment to the Health Choice Board as representing us as the Health Officer for Wayne County Public Health Division.
That slot is predetermined, correct? That the health officer sits on the board.
I believe so. Yes, that's how it was explained to me.
We also have our Executive Director for Health Choice with us. Name and title, sir?
Chris Johnson, Division Director for Access to Care and Executive Director for Health Choice of Michigan. That's correct, Commissioner Clean. All appointments on the board are determined by positions held in Wayne County.
Here to do a very brief description of what Health Choice is and what we're offering the public out there.
Sure. Health Choice works with a lot of the people that struggle with health coverage. Our biggest program that we offer is health coverage for our small businesses in Wayne County. Currently, we have over 7,000 people on the program, which make up over about 1,500 small businesses. We also have a few standalone programs, individual dental, vision programs for our residents. So many of you may have just recently received some prescription saving cards in your mailbox. Those are something that Commissioner Alicia Bell asked me to get printed again. We did that a number of years ago, but it's just cards that you can give to your constituents, your residents out there, anybody that does not have prescription coverage or may have poor prescription coverage. It's a very similar program to GoodRx. So if you want to use them, great. If anybody needs any additional cards, just reach out to myself or Commissioner Bell.
And I received my half box yesterday. Business cards. Are there more available if commissioners run out and they want to have more to distribute?
Absolutely. We can get more printed.
And they get a hold of you, Mr. Johnson, to let you know?
Yes.
Okay. Commissioner Marecki.
Thank you. I did receive my cards and I haven't received them before, so I didn't quite know what to do. So if we hand this to someone that has poor prescription or no prescription, then there's a contact for them and someone will work with them or?
Correct. They can just take it to a local pharmacy and use
they
that card.
can.
Right.
Oh,
And on the back of the card, down at the bottom left, there's a website. And so a resident can go onto that website and put in what prescription they're trying to fill. And it will give them locations they can go. And if they click on those locations, it will also show them the cards.
okay. Well, thank you. Great.
Cost item these days. Yeah, Commissioner Anderson, I'm sorry.
Thank you. I was checking your right side vision out. So, but anyway, I just wanted to ask Chris.
Yeah, I'm trying my best.
Chris, so it doesn't matter what insurance they have currently, but they could use this as a comparison to the cost or the savings between whatever they have, if they have anything. Correct? They
Absolutely.
can use them in conjunction with their coverage current.
Right,
All
right.
right,
Someone could
thank
check the cost of a prescription drug with their current coverage and then ask the pharmacist to run it with that card and see what the difference is.
Great, thank you.
And I would ask commissioners also, those of you that are on Facebook or whatnot, when you see the health choice, because we are upping our public profile and doing a little bit more marketing. If you can share that health choice that you see on Facebook around, it really is a good program. It's a good insurance vehicle that we have. And good coverage, and we are on the lower side of the expense costs for insurance plans like ours, and with all the small businesses out there that have been going through so much. Commissioner Anderson.
Does that include vision and dental also, or is it strictly medical and prescriptions?
Oh, for the prescriptions?
Does it include dental, vision, medical, and prescriptions?
Yes.
All of the above?
Yes. So the vision and the dental are riders onto the program. So there's a basic medical program that some can choose, and then they can add on the vision and dental.
Okay, all right, thank you.
And this is an ACA approved plan too. Commissioner Marecki?
Thanks for recognizing me again. So all of these appointments are Health Choice Board appointments?
Correct.
You guys appoint them all?
No,
I mean,
they're-
we agree to it, but
yeah,
your
they're
board appoints?
right. They're based on our bylaws state according to positions held in the county.
Okay.
So that's who goes onto the board. So
So would Commissioner Baker McCormick, because she's the head of Health and Human Services, be on it?
correct.
And Tim, of course, is involved in a lot of different,
Yes, and it's also, he's on the spot of one other member from HHS committee.
oh, okay. And then Commissioner Bell, because
And the
she's the
chair.
chair.
Yep, then the deputy county exec is on
Okay.
it, public health officer, the director of HHVS, and then the deputy director of HHS.
Okay, all right, great, thank
Seven
you.
positions.
Yeah, who sits on the board is specified.
Yep.
By job classification or whatever. I'm sorry, Commissioner Anderson, do you have more? Commissioner Marecki?
No, I'm all set, thank you.
Any other questions from commissioners on these appointments? All right, I think a motion is in order.
I'll move approval. Or,
Marecki moves, Commissioner Dobbs supports on item 3. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Abstentions? All right, we will roll the agenda to item 4, Madam Clerk.
Item 4, requesting commission approval of Amendment 3 to a 2-year contract with 3 one-year options to renew with Black Family Development.
Okay, somebody from the department on this? Welcome back. We'll take your name and title again. There we go.
Leslie Hoagland, Administrator in the Juvenile Youth Service Division for HHVS. These are the CMO's third quarterly adjustment and our rebalancing for fiscal year '23.
All 5 are here. The 5th one came in the addenda.
Yes,
So the chair will consider, when it's time for a vote on items 4 through 8. These are just quarterly adjustments based on encounter data that each of the CMOs has. So we just adjust the budget based on encounter data and onward we go, correct?
correct.
Questions from commissioners on these items? Order.
Move approval.
or,
Anderson moves, Commissioner Dobbs supports. Any discussion at all on these? And Commissioner Anderson's, that's items 4 through 8, correct? the motion. All right. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Any abstentions? All right, motion passes. Thank you, Madam Clerk.
Moving to the addenda, item 9. Boarding notification of an emergency procurement report with ABE Solutions.
Okay. Somebody from the department on this one? Wearing you out. Yep, you're.
Leslie Hoagland, Administrator in Juvenile Youth Service Division, HHVS. This item is an emergency item because we needed mattresses for the Dickerson facility. And we had a short window to procure the mattresses, and they have been delivered and paid for.
Okay. So all of our youth are out of the juvenile detention facility and at the Dickerson facility.
That's correct.
You have you calculated the cost of that move?
No, I have not.
Yes, sir. Name and title.
Kamal Kaparu, Management and Budget Finance Director for the Department of Health, Human and Veteran Services.
Welcome, Mr. Caparu.
Yes, sir. The total move cost as of now was about $160,000.
Really? Yeah, I was concerned when I first saw it because, of course, the job I have and where I'm sitting, it's like, how much is this going to cost us to make the move? So everything's up there. All the youth, everything is up there. And, okay, 100, how much?
$160,000.
Questions from commissioners. Commissioner Anderson.
Just wondered if you could tell, is it the facility operating the way, are they getting all the services that they were getting at the youth detention facility?
I'm gonna step back on that one.
Okay. I'm just wondering how the food service and everything is going.
As far as I know, everything is operating as it was at the JDF, the food service. They're getting showers.
Does anyone, I think someone mentioned the other day that they had gone to the facility, and I can't remember who it was, but that things seem to be operating okay. Is there anyone that will make periodic checks there that'll make sure that things are moving smoothly and those kids are taken care of?
Yes, the Division Director, Melissa Fernandez, she spends a great deal of time over at JDF, so she's monitoring the services that are provided there.
Thank you.
That means the school is up there now too, right?
Yes, I think they were doing, Mrs. Jordan is on.
Who do we have?
This is Melita Jordan, Director for the Department of Health, Human and Veteran Services. So I can answer some of those questions that was asked.
Yes.
Thank you. Chairman Colleen. Everything is operational and intact at the Dickerson facility. As Kamal mentioned, we have the $160,000 that was spent in terms of making sure that everything was in place. The mattress cost was approximately $200,000 because we had to buy brand new mattresses. The ones that was at JDF did not fit the beds that we currently have at at the Dickerson facility. So we had to buy new mattresses and also had to buy the appropriate blankets and so forth to outfit the bedding. And so all that's in place. We also have the laundry being done. The food is actually prepared at the facility. And so that is also in place. There's recreational activity. The school is up and running as well. And as Cecily mentioned, the Director for Youth Services Ms. Fernandez is there, along with the two deputies are there on a regular basis. Chair Bell actually visited the facility a week ago, along with myself and the Chief Operating Officer, Janelle Allen. And Friday, we also had several of the Third Circuit Court judges also visited and spent nearly a half day there, talking also with the juvenile residents, in addition to providing, watching several of the activities that were going on in the facility. We have the mentoring program that's beginning, and also the social services, the medical services, dental services are all being implemented and operating on a daily basis.
Thank you for that, Director Jordan.
You're more than welcome.
The other question I have too is, for something like this, was there have to be like an inspection and something along the lines of a certificate of occupancy or something in order to reopen?
That's correct. And we did have, the state came out twice to inspect the facility prior to us moving in. And they've been there a few times also to provide us with the license. And so it is licensed now as a child care facility. In addition, the fire marshals came out and had to inspect and also give us a certification saying that it is, the entire building is safe. And so we have went through all of those appropriate regulations and the appropriate licensure to be now considered a juvenile child care facility.
Lot to do before you can open that.
That's correct.
Yeah. Thank you for that, Director Jordan.
You're more than welcome.
Commissioners, any further questions, comments on buying the mattresses? Anderson moves and Commissioner Marecki supports.
This is a receive and file.
Sorry,
This is a receive and file item.
file. Oh, because of the amount, right? Yeah. So that's a receive and file. Commissioner Marecki, you second a receive and file item?
Yes, yes.
Good. Emergency procurement, yeah. Okay, motion before us properly. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Alrighty, that is approved. Forwarded to full board. Madam Clerk, what's next?
F, such other matters as may be properly submitted before the committee.
I don't believe there's any.
Public comments.
I'm looking at people coming in on Zoom. Is there anybody that's on Zoom that would like to have public comment to the Health and Human Services Committee? Anybody on Zoom? Did we get any emails, Madam Clerk?
No emails.
Public comment?
The audience.
Oh, yeah. People that are here with us today. Yeah, it's been funny doing public meetings. Anybody in the meeting room? All right. Don't see any public comment. We'll move the agenda. Madam Clerk?
Adjournment.
All right. Without objection, we stand adjourned. Thank you, everybody.